First off, your own personal health history. There are some medical conditions that can increase your risk of developing cancer. For example, inflammatory bowel disease increases the risk of colon cancer. Having a history of colon polyps that are precancerous increases your risk of colon cancer. If you have a HPV infection, human papillomavirus, that can increase your risk for a number of cancers, cervical and oral and anal and penile. So knowing these risks help us to identify who is at increased risk and may need additional or more frequent screening. Additionally, a cancer survivor is at increased risk of a second primary cancer. In other words, a totally new cancer, generally unrelated to the first, although in some cases it may be related to a common genetic link or even to the treatment that we offered for the original cancer. Certainly, having a family history of cancer puts an individual at increased risk, especially if they have identified mutation in cancer-causing genes. And there are several of those genes that have been identified, such as for breast cancer. Many of us have heard about BRCA or BRCA. There's also genes for colon cancer and others. Racial and ethnic background can increase your risk. I think probably a lot of the men in the room are familiar that African American men are at higher risk of developing prostate cancer. Hispanic women are at higher risk of cervical cancer. Ashkenazi Jewish women are at higher risk of breast cancer. So these are all factors that we want to consider in understanding what an individual's cancer risk is. We have developed a cancer risk check, and it's on the MD Anderson website. If you go to mdanderson.org/risk check, you can go in and answer a series of questions, and it will help you to understand what your cancer risk is and what cancer screening test we would recommend based on that individual level of cancer risk.